Hello! Welcome to this week's video. So this is all about how to prep your skin for the style of treatment I do called medical needling. Clients often ask me this question, so I'm going to put it in this video that we can listen to in your own time. So what is medical needling? So what I do is a little different. So I combined 5 different corrective therapies and I call it medical needling. In those 5, one of them is platelet therapy, where I'm creating micro little holes in the skin or wounds, which is causing a cranial bleed. So in that blood is human growth factors that are being released, but we're actually creating a controlled trauma to get the body in that DNA locked deep inside is an ability for the body to regrow back younger and stronger. So that's what we want. When you let's give an analogy. Sometimes asked, does it leave scar tissue? Well, no, definitely not, because if you even think about if you had a needle and you were sewing and you pricked yourself with a needle, there's a scarless healing. So there's a phenomenon with this type of injury that it will not leave a scar, to the point where it actually is wonderful at treating scar tissue. Now in Germany, because of independent research, Environ Skincare plus needling is covered by insurance, which is amazing, which means burn victims can now enjoy their amazing results of medical needling to restore their burn scars, and their insurance is picking up the tab. Now in Australia, that isn't quite the case yet, though it is done. Unfortunately, medical needling is the most expensive form of scar therapy, but in my opinion and what I've seen throughout my 25-year career, it's the best. It's so wonderful because you're stimulating the body's natural wound healing cycle and working with it, which means that the body's going to grow back natural collagen, and what's unique is elastin, which you don't get when you cause heat damage to the skin, that's for example in laser. Now I'm in the middle of a course in needling right now, so I've done 3 sessions 7 days apart and I have 3 sessions to go. You might notice with my skin, it's a good example. See how it's flaking? So today, Saturday, Sunday, Monday, Tuesday, Wednesday, so I'm on that day 4 and I'm still shedding. Can you see in my nose here? So that's all shedding. So as I am growing from inside out, and that's what the skin does. It's a organ that regenerates itself, but as it loses its resources, it starts to become unable to do that job. So with medical needling, I'm combining 5 therapies tailored to the skin I'm seeing in front of me. And one of those key parts of it is releasing the growth factors through creating micro holes. I am using a special treatment so they are blocked, they can't feel much. And then we're following that with a treatment to stimulate the growth factors. And then we're doing technology to pulse active ingredients all into there and promote wound healing very quickly. And then locking it in with a vitamin therapy. So lots of things going on in the treatment. The treatment takes 2 hours and it's tailored for the individual. So why would you need to prep your skin for that? Well, it's kind of like having a baby or a surgery. It's capital medical. It isn't a cosmetic therapy as far as in, out, by. It is designed to start a process in the body to regenerate itself. So the healthier your skin is and your blood is, I'm relying on those resources to be very dense with vitamin A and antioxidants and nutrition. So we're going to get a massive wound healing response, which means we're going to get a massive flood of nutrition that's going to come and heal the tissue. Once I perform 6 needles, then we're going to see rejuvenation. I want to see it for 12 months. So the body's going to keep regrowing. So I joke it's the gift that keeps on giving, because once I complete number 6, you're going to keep keep going. Now 6 is the minimum number that they did in research. I personally did an experiment last year, probably not by choice, but it just happened. Normally I do a course of needling every year on my own skin. Last year I did 4. This year was the first time I've had problems with some of my old pesky skin problems, and some new ones had popped up, and I was really struggling to maintain them with my home care, skincare routine, with my treatments. So as soon as I started prepping my skin for needling, it took me a couple of months to get my skin to where I wanted it to be. And I'll go through quickly what I did in a minute. But then I've been able to get those skin problems I've already cleaned after probably the second needle. I haven't seen them come back. So prepping the skin and the body is going to get you long-term results for your concerns. So what does the skin need to do to qualify? Well, the more vitamin A you're storing in the dermis, the healthier your barrier, the more hydrated the tissue. We don't want a needle stressed skin because you're relying on those nutrition. So we want a needle healthy tissue. So we're wanting to get that skin healthy, and just because you're using the good skincare doesn't mean it's healthy enough to needle. So we have to have a look at the skin and assess it. I was doing a lot of medical DF Pro facials to pulse in vitamin A into my problem areas, and I was doing 3 a week at least, and then I had a special home care routine, and I was taking supplementation and lots of green drinks and mineral drinks to really boost my wound healing response, cleaning my blood, making sure my adrenals and my hormones were very, very nourished, which meant I'm going to heal really, really well. Again, I always use the saying, stress equals demands minus resources. So if you ask a builder to build you a house, that's a demand. But you say, okay, but I'm not allowing you to have any building material to do it. That's resources. And then you're getting annoyed because your builder's not performing what you demanded. That's kind of how the body works. The body needs nutrition. It's has natural systems to regenerate and heal itself, but if you don't have enough nutrition in the skin cells, in the blood, and the nervous system, let's say, is overstimulated, you're not going to get a great long-term results, because you're actually wanting long-term results for a lifetime. And needling is an antagonist, which means it's putting pressure on the body to rebuild itself. So you just want those resources to be very, very healthy and on demand, so to speak. And that's when you're going to be really happy with the investment you make with needling and the time it takes to do it. So it's 6 treatments, 2 hours in duration is what I do, because I'm combining 5 different therapies, not just the platelet release therapy. Every year I change how I treat, because I'm seeing in the clinic anecdotally how people are responding to therapy, and then I'm learning myself always, and then every year I do my own needling, and I change my style, my technique, what I believe works the best, and I'm always learning to try and make it better and better and better, because it's kind of my little baby, and I want the best outcome for the client. And that's why I work very, very hard to kind of figure that out. And the more I'm learning, you do have to create a decent amount of stress on a healthy skin to get that 12-month regeneration and to get structural change within the organ. So that's where prepping the skin cleverly, and that's where I have to work individually with you to help you with that, because it's not a one-size-fits-all at all, and talk about what would be the investment and how we'd go about that. So I just want to have a quick video on it, 9 minutes long, hopefully that's it. Any questions, please ask away. But for now, have a great day, and I'll talk to you soon. Bye.